Tell me about your life before the surgery.
Well, I don't think I really realized how much I hadn't been doing,
Mm-hmm.
and so I really watched what I was doing. I could hardly lift anything, and my back hurt all the time.
Mm-hmm.
So life is good after the surgery because
Mm-hmm.
I can lift things. I'm very careful about
Mm-hmm.
what I lift still, but I can lift things, and as long as I try not to do it too heavy,
Mm-hmm.
then I can actually walk without being bent over, and that's probably my biggest.
Let's talk about still before the surgery. 1 to 10, how bad was the pain?
Well, when it was bad, it was a 10.
A
And
10.
I
For
mean,
how
I'd have
long?
to go sit down and lay
Yeah.
down and probably take a muscle relaxant and just to get rid of the pressure and the pain and the sciatic nerve pain and things like that.
How long did you struggle with that pain?
Well, I've had it for 12 years off and on,
Mm-hmm.
but the last year and a half, probably the last year before I had the surgery, I struggled.
Yeah,
Just
and we noticed inside, you weren't imagining it. The bone was on bone, many of the discs were gone, your spine was side bending, you had a scoliosis, and that you had a major problem before the surgery. So your pain was very well understandable. Now, in that 12 years, or maybe in the last 2 years before the surgery, what did you do for this pain? How did you get over everyday activities and so on?
Well, pretty much I lived on
Mm-hmm.
Advil and
Mm-hmm.
Tylenol. I tried not to take muscle relaxants, but when
Mm-hmm.
I called it tweaking my back. So if
Mm-hmm.
I would lift wrong, then I would have to either go to chiropractor, physical therapy,
Mm-hmm.
or I would go back to the doc and I would get
Mm-hmm.
some type of muscle relaxant and take those for probably a week or two, and then I'd be pretty good. And then it didn't take a whole lot to set it off again. And
Did you
then
see any surgeon before you see me?
I
Before you
had
saw me?
not seen a surgeon for
Mm-hmm.
about 12 years, and I fell on black ice, is how I broke
Okay.
my back to begin with. And I
Mm-hmm.
saw the surgeon probably 6 months or so after that, and he's like, this never goes away. It was a spondylolisthesis.
Okay.
And he
Yeah.
said, it's just going to get worse. You might want to think about having it done before it comes emergent.
Mm-hmm.
And not a whole lot. It was traditional. I'm going to cut you this way. We're going to
Mm-hmm.
put rods. And he didn't really go into a lot of detail with me about what he was going to do. It was
Mm-hmm.
just the way it was. And then he said, you're not going to do anything for 90 days, and then you'll start physical therapy.
Then you start physical therapy
And
after 90 days.
after 90
Did he
days.
explain to you why?
No, he pretty much said this was his standard procedure.
Mm-hmm.
It's
But
just,
he's realistic. He was realistic
I
about
think he
that
was.
because amount of the damage we cause in a regular open surgery, we literally fillet you open, and we have to wait until those muscles they lose their spasm before we can effectively use the rest of whatever is left. Because when we cut the muscle, we kill them. They die, and we wait until after open surgery where we fillet you open, we wait until the spasm goes away before you effectively can do anything.
that is true.
Yeah, and no, but you told me about when I told you. Then we met, we went through all the steps and so on. How did you hear about us?
Well, my son is a physical therapist,
Mm-hmm.
and they were
A
actually
good
just,
one, I may add as well.
so he was starting a relationship with yourself, what
Mhm.
services they could offer in Alexandria,
Mhm.
and my back had went out, and he
Mhm.
just said, "Would you be willing to drive?" It's a drive for me to come
Yeah.
here. It's probably 3.5 hours if I just drive straight to come and
Mhm.
see you. And he just explained who you were, that you did non-invasive back surgery, and
Mhm.
would I be willing to make that drive and
And
see
that
you?
is first of all, thank you for taking the time and driving. But that is a common story that people who look at our data, I showed him and his group actually our data, what the impact is of what we are doing. Every time I show that, and this is people are so impressed with the result, with the data, that they are willing to go the extra mile and extra 9 miles, and encourage their families to have spine problem to come and see us. That happens all the time. People who understand the data, they truly understand that what we are doing is very different than what's out there. Now, you said you still were a little distressed that when we talked about that you need a surgery. Tell me about it.
Well, you had given me a back injection, and I have osteoarthritis,
Mhm.
so I've had enough other injections to know it didn't last maybe 60
But we
days.
still tried all the other treatment before the
We
surgery.
did, and it didn't
Yeah.
work, but in my mind, I was thinking I was coming back to see you,
Mhm.
even though you'd been clear, we have to try this. If it
Mhm.
doesn't work, it looks like a candidate for surgery. So
Mhm.
when you told me in January of last year that the steroid therapy had failed and your physical therapies failed and you're going to need back surgery, I was in disbelief at that time because I'd
Mhm.
had bad back for so long, so I just thought, well, I'll just get another injection and
Mhm.
away I'll go, even though in the back of my mind I knew that wasn't gonna
Mhm.
happen. So, yeah,
And that is what we do. See, open old-fashioned surgery is so damaging, so risky. Sometimes we just push it out as far as we can, and our patients are losing years, are losing productivity. They are losing literally their social life because we put the threshold very high to offer them surgery with us because our surgery is so much less risky. We put people, yeah, through another course of conservative management, but this is a time limited thing. So once we are sure that that's not working, there's no reason to push it out. We go and take care of it. Now, we did the surgery about 4.5, 5 months ago,
correct.
and contrary to what people think, I don't always put my best results out there. You had that nerve irritation. Tell me about it. How did it feel?
Well, about 4 days after post-op
Mhm.
surgery, which really actually wasn't too bad, but
Mhm.
I started getting severe burning sensation, and it started in my lower left side of
Mhm.
my back, and then it would wrap around and go down the front of my left leg
That is the L4 nerve root.
until it got to the
Mhm.
knee. But and I know you'd explained to me 4 times that that could possibly
Mhm.
happen, and I've only associated sciatic nerve pain
Mhm.
with that. I didn't know what firing
Mhm.
nerves meant, but it is like you're on fire, and there's absolutely nothing that you can do for it
Mhm.
until you put me on a med called gabapentin.
Gabapentin,
And
yeah.
then gradually working up to it, that took care of it. But that was terrible, and I think people need to recognize that and
Yeah.
call right away that that's what they're experiencing,
Yeah.
because I did not.
Now let me show you first what we did. You had a scoliosis. First of all, your scoliosis is corrected, and here is the picture from the surgery that we did. All these screws are in perfect position. Look at that. The screw is barely bigger than structure it has to go through, but it's dead center, and all of the screws are good. And bone 4.5 months later, already growing. Look at that, how solid the bone is here in the middle of that spacer bone is growing. But as well, I could see here that, look at that, in the back, bone is solidly growing. In some places better than the other, but fusion is actually there 4.5 months. After open surgery, that process takes at least 9 to 12 months. But with our surgery, because we don't disturb the tissue, that is much faster. How long did you stay in the hospital?
I stayed two
Two nights?
nights. I had the surgery on a Thursday, and I stayed Thursday night and Friday night, and was discharged on Saturday morning.
Now, 4 days after, you had this pain going down the leg, and the reason you had it a few days after the surgery is because I numb all the tissue and the nerve at the surgery, and that is how long it takes for your body getting rid of the medication. So, and if you remember, we talked about that 3-4 days after the discharge, pain can get worse sometimes, and that exactly happened. Now, we put you on the gabapentin, and you told me that helped you, but that's some side effect. Tell me about that.
Well, the gabapentin worked really well. It's a med that you increase the dose on until you get your maximum dosage. But what I've
Perfect.
noticed,
You said you nailed it. It's not a medication that you take only when you have symptoms. You take it constantly and build up a dose, and you go slowly up, you go slowly down. Please continue.
yes. So I was on, I think it was 2,700 milligrams. It was 3 big capsules 3 times a day.
900 3 times a day.
Yes,
Correct.
and but what I noticed is that it started messing with my mind, for a lack of better words, and I had a very difficult time remembering things. If I could talk to you
Concentration.
and say something to you, and I would probably walk out the door and forget it, but if you brought it to my attention, I would remember it.
Typical
But
side
to
effect.
execute,
Yeah.
I couldn't do that.
As well, some people tell me that, especially if you go rapidly up and down, that the blood pressure becomes a little labile, and they get lightheadedness and so on, and concentration. That's all.
That's
Is because your brain doesn't get enough blood supply, because it changes how your body regulates blood pressure, among other things. And so this is a typical side effect of gabapentin.
It worked really well. So I had really started doing my physical therapy, and my goal was to try to start reducing it at 90 days just to see if I could, because I worked so hard on my physical therapy to try to make me stronger. And the physical therapist actually focused on a lot of nerve exercises to do to try to get those nerves to calm down, and that
How
was
long
really
did it
the
take for
focus.
that nerve to calm down?
Well, I started to wean off. You started me on gabapentin the last week of June, and I started to wean off of them. I started in September, and I was successful about the middle of October. So it took me a month to wean off of gabapentin, and I didn't realize it can produce some withdrawal syndromes, and I did it slow, but
still,
I still did. I was headachy and body achy for about 4 days.
Now, if you remember, we as well talked about in big surgeries like that, most of the time, not in the first month, but in the second month is when most of my patients noticed the most of the changes, most of the improvement. Was that the case with you as well? That the first month was rough, but the second month you started getting better?
My first 3 weeks were rough, and then I started getting better and increasing. I think what helped me is really working closely. I don't know that I was ever without exercise plan. And even today, I discharged from my local hometown, but I still have a PT package that I have to do all these exercises with. So that's how I started just to get better, and they started focusing. And so, about the second month is where I really started noticing I could increase my walking distance. And before it got really cold, I was up to 3 miles a day walking.
What about going back to work? How did that go?
I went back to work at 8 weeks. I probably could have went back to work based on just physical signs after probably 6 weeks. But the gabapentin really did mess with my head, and I just couldn't concentrate or focus. So I took an extra 2 weeks of full time, and then I went back for 2 weeks part time.
But you were within 2 months back to work.
Yeah.
After a surgery like that, the average return to work is somewhere between 4 and 8 months. That's average. So we cut practically your recovery, even with our difficult start, because most of my patients don't have that nerve irritation. Even with difficult start, we cut the return to work to 1/3 to 1/2 of what is open surgery would expect.
Oh, I have a housekeeper. And my place
Talked
of
about
business.
that,
And she had one level done, and she came back 90 days later, and then just started physical therapy. And actually, she had it with the doc I had seen 12 years ago. So, and she struggled for a while after that.
Comparing yourself to her, what do you think? What's the advantage of that's minimal invasive? What you got comparing to the surgery she got?
Well, she was in a lot of pain, so she had talked to me. I called her, and she called me right away after she'd had that surgery, and she was in tears. She had to go to the emergency room and get pain meds to handle her pain. I didn't have to do any of that, even though I had the nerve issues that came later. As far as the actual back pain, I honestly would never have called and asked for any additional pain meds or anything like that, because I didn't need them. I needed just the med to take care of
most of our patients without the
nerves.
nerve irritation are exactly as you described. But and then the return to life and activities, if you compare yourself to your friend with the open old-fashioned surgery, what do you think was the difference is from the knowledge you got from her?
I already know I'm doing really good compared to other people, because I had my daughter-in-law's friend, her mother had back surgery, I think traditional back surgery, maybe a month or two before I did. And I was already walking 3 miles a day. And she said her mother was, at that time was 90, I was doing 2 miles a day, her mother was 90 days out. And she was walking from the Davenport to the kitchen, and that's all she could do. And I'm like, and how far out is she? I was really surprised by that.
How's your walking?
Very good. And I had years, because of the scoliosis, I was bent over all the time, plus I do a desk job. And so when I walk, I have to practice gait training in my mind, so it's always heel toe. Then I started eyes to the sky, or when I'm outside, meaning I should be able to see the horizon, not bent
It's
over.
a training.
Looking
You have to
it
get used to
is.
that, yeah.
It's very hard when you're used to being bent over all the time. And so I didn't increase my walking past 3 miles. Instead, I focused on better gait training, better walking, better balance.
Oh, 3 miles is a lot.
And
I'm not sure. I didn't have back surgery. I'm not sure if I can walk 3 months.
well, I've always been an avid. I used to be an avid runner, and then I was a power walker. So that was very important
Good.
to me.
No,
But
no,
I just
I'm
felt
very happy
until
about that.
spring, I will stay at 3 miles.
Now, in a surgeon life, there are certain things. Obviously, we get lots of satisfaction about the good results and so on. But there are some things that they are not put in medical books and so on. And that is, you told me your son Nick, who's a physical therapist, a good one, who sees lots of this problem, who sent you to us, just hugged you and told you something. Tell me about that.
Oh, that's right.
What happened?
So I hadn't seen him since August, and I went there in the first part of August, and I went there for Halloween. And I just had kind of joked around with the physical therapist. Your job is to make sure I can stand up straight so my son, the PT, doesn't notice that I'm bent over. So I was always worried I was going to get out of my vehicle and he was going to say, "You're worse than when I saw you last time." And I forgot about that. So a couple of things happened that weekend. As soon as I got out, he came and gave me a big bear hug, and he's like, "I cannot believe how straight and tall you're standing." And I was like, "Wow, that's so good to hear." And then when I had stayed with him after the surgery, he has a park really close by, and I had a wheeled walker, and we would walk the dogs and walk all the time in that park. So my granddaughter and I were walking the dogs, minus a walker, in October. And I was telling her it felt so weird to walk that park without my wheeled walker. And she's so innocent. She turned to me and she goes, "And Grandma, you're standing so much straighter than you were when you were walking before." So that was a big thing.
And moment like that is giving a surgeon like me truly meaning to what we do. Because in the med school, in the residency and so on, we are made to be mechanics, good mechanics, people mechanics. We are trained, to separate the emotion from the mechanical side. But once everything is done, this kind of stories are actually what give meaning to all that 23 years of education I went through, to be able to, with a surgery that it was with barely 1.5 hour, give you back to your family. A surgery that for in any other way would have been like an 8-hour surgery, a 12 months recovery time, and way more complicated and so on. But I think these stories that we don't learn to deal with in the med school is actually what give our job really meaning. So thank you for sharing that.
Well, thanks for the surgery. I'm so happy. People ask me that all the time. Would you do this again? And I always say I would never wish the nerve pain on even my worst enemy. But I am so thankful that I had the surgery done, because I'm so much better than I was.
Thank you so much. I really appreciate the interview.